Hello, my dear patients. My name is Dr. Violeta Fodina. I'm gynecologist, reproductologist with the experience of the 25 years. And today we are on the IVF Clinic embryo laboratory, and why you will very soon understand. One of the questions what I want to discussing with you today, this is a situation which happened after the IVF treatment. It's non-results after the embryo transfer. And we have the name for this situation, or we have a name for this diagnosis. This is a failed implantation. What is it and how often it's happened? The common statistic today show the positive outcome after IVF around the 45%. It means 65% of the patients who going for the first trial not succeed. The reason for this situation, the different one, and of the main factor why it's happened, this is the quality of the embryos. And the question, so what is it, the quality of the embryos? One of the part of the quality, of course, this is how look the embryos during developing time. The second question, how fast these embryos developing, and the main factors which give the effect for the implantation and for the future embryo development, it is a genetic status of that. And today we will be slowly going through all these factors. Morphology, what is it? With the simple words, this is how many cells have the embryos, how they are developing, how this cells volume growing up during the 5 days. And if to be clear with these questions, we now going to embryoscope pictures, and I will show what I mean. Now we see the screen from one patient's results of embryoscope. We see the end of the results. We see how looking all embryos which going during the 5 days incubations. And you can see, of course you are not specialist, but you can see the embryos not only coloring in the different colors, so of course the IE helped to us to be clear with these questions, but also you can see how looking the embryos, they're looking absolutely different. Here we can see the blastocyst, which is have a good quality, and we can see the embryos which stopping in the different stage of the development. So now we will see how they develop the normal embryo. First of all, this is the oocyte which already fertilized with the ICSI method in IVF laboratory. So the fertilization with the ICSI method happened 4 hours after the collection of the egg, and after that the fertilized egg put to the incubator for the future development and controlling of that. So the fertilized egg stay around 17-20 hours in incubator till moment when we can see the first fertilization marks. This is a pronucleus inside. So to the next day, approximately after 24 hours, we can see the first development of the zygota. Start with the 2 blastomer or 2 separate cells. And after that, this embryo continued to develop, and on day 2, after the fertilization, amount of these cells in the embryo might be from 2 till 6. The ideal norm, it is a 4 blastomer, and embryo continued to develop, and to the next day, day 3, after the fertilization, we can see around the 6 to 12 blastomers in each embryo. This is a normal development of the embryos. And what happened after that? Day 4, between the specialist embryologist named the porridge stage, when the amount of the cells growing up extremely and doing the common mass of the cells. And after that, they started the first differentiation. The cells started to differentiate for 2 kinds of cells. First one, this is stem cells from which will be developed the baby, and trophectodermal cells with which these embryos will be implanted or connected with the endometrium. If these processes happen, one of the processes that might to happen with the embryos, this is a natural hatching, when the embryo broken the membrane and going through this entrance to the medium, and after that connected the endometrium. But in the modern medicine, we using routinely the artificial hatching. We are doing the entrance if the embryos will have the easy way from the membrane and have a higher possibility of the implantation. And now we will see abnormal development of the embryo. Of course, the start of the process is the same. The oocyte, which was retrieval from the woman, preparate, and after the 4 hours after the pickup happened the fertilization with the ICSI method, and the fertilized egg have put it to the incubator for the future development. So we can see that these embryos, first of all, the oocyte have abnormal form. A lot of extra liquid we can see around the oocyte. Inside we can see some kind of dots. This is the pronucleus, and the amount of this pronucleus is more as a norm. So the embryo started with bad luck, and we will see what's happened after the short time. So how you see these embryos continue to develop, and also doing the 2 blastomers, and the blastomer looking not bad, but the day 2 when the embryo needed to develop for the 2 to 6 cells, we see the 3 blastomers. It is already the not good marks. The embryo continued to the cleavage, and in day 3, when we are needed to see the separate blastomers, we see some kind of mass of the cells, which is also not good marks. We see the embryo during the day 4 and 5 not doing any correct stage. They continue to try to develop, but the development is abnormal. So you are seeing it morphologically, the embryo might be good and bad. But what to do when all embryos looking similar good? Do these embryos have the similar potential for the normal pregnancy? No. The potential of the embryos will depend of genetic quality of the embryos. And one example, looking the embryos 1, 2, 3, excellent morphologic blastocyst. Do these embryos the similar good? Do these embryos have a similar potential to give the healthy pregnancy? Let's see. And now we can see the continuing of our examination of the embryo. This is a genetic report. We are seeing it through 3 good blastocysts, which is excellent by morphology quality. But looking how different they are genetically, the one of the embryos have the normal amount of the chromosome. These embryos have a high potential for the implantation and pregnancy development, and 2 of them have a wrongs in the chromosome, and it's give the probably failed implantation or the light biochemical pregnancy. So in the end, no, the pregnancy. So the conclusion, the examination of the embryos and the controlling of the 3 parameters of the embryos have a significantly increasing chances to get the pregnancy after IVF treatment.